everybody. Welcome to ABA Inside Track, the podcast that's like reading in your car, but safer. I'm your host, Robert Perry Cruz, and with me as always are my fabulous co-hosts.
Hey, Rob, it's Diana.
And it's me, Jackie.
Oh boy, guys, I am so excited. This is an episode. It's been a while in coming. We had it scheduled, then life, and now we're finally getting our chance to talk about the contingencies that occur during delay tolerance training. But before, in case you listen to this thinking, ABA Inside Track, it's a train podcast. No, it's a podcast about behavior analysis and behavior analytic research, where every week we pick a topic and discuss some relevant research articles. And sometimes, like this episode, we are very lucky to have a great
real-life train.
Real-life train. No, stop. No, you're mixing the message of the show. That's not what we're about.
But
behavior analysis.
Sometimes I wish we were, because I do love myself some model trains.
Well, that's a different show. That's well, I don't even know. Trains Inside Track. That's a terrible title. Think of a better one.
I went off the track.
You definitely did there.
Go ahead.
Yes.
You were probably about to introduce.
I was about to introduce our very special guest, who we're very excited to have. The author on the paper we'll be discussing in depth. Someone who knows all about this stuff, the no delay tolerance training, whatever term you want to use. I know there's all new terms. The kids and their new terms. We have on the line Dr. Mahshid Ghaemmaghami, and she's here to talk about our article. Mahshid, hello.
Hello. Thanks for having me, guys. You guys are awesome. I don't know that I can keep up, but I'll try.
You know what? We just have to do that for like 30 seconds. And now you talk about your article intelligently for like 45 minutes, and we got an episode. So.
Nice. Well, thank you so much for having me, guys.
Of course.
Yeah,
we're very happy to have you here. So, Mahshid, luckily you're here, because it is exciting as sometimes excitable as I think we can be. It is always nice to have an expert in the research we're discussing who can guide us through. And I think while the article that we'll be discussing that you were the head author on explains itself very well, it also has a lot of layers. Has levels of complexity, so very readable, but you can't skim it. You can't just jump to the graphs and kind of say, I read the abstract and the graphs, I got it. This one needs a little bit more in-depth talking, I think.
It's not a skimmer.
It's not a skimmer. Before we get to that, I don't want to skip ahead. Could you please tell our audience all about yourself, or as much as you want to talk about yourself, I suppose.
Sure. Well, I guess the relevant pieces are, I entered this field as a sort of ground up. So I kind of started working with some little kiddos on the spectrum and working as a therapist. And so, sort of the implementer of many of the procedures that I may be handing out to people to actually implement. So that was a really good perspective on, what it is that you're asking someone to do, to really know what it takes to do that. So I really enjoyed that part, and just kind of connecting that way. But very quickly, I was doing my master's in Canada. I'm from Canada originally.
Woo! I love Canada.
I shouldn't say originally, but for the majority of my life, we realized very early on in my career that there was something missing. I, as much as I really wanted to help, and we had these kiddos in our programs, and we did great work, and they were doing well. Anytime we transitioned out of that environment, we were struggling maintaining our effects and whatnot, and having our students go and learn in more typical settings. So that kind of prompted me to realize that I needed to learn more, that there was a lot for me to still learn. And then I got lucky and happened to be at a conference with Dr. Hanley, was in Canada, talking about 10 things that behavior analysts do wrong, or that he's done wrong in his career. And it really resonated with me. And I kind of was just inspired to learn from him. And I got very, very lucky. It sort of came together, ended up at Western New England, kind of not too far away from where I am now. And I did my PhD with him. And the article we're about to discuss is my work, is my dissertation during those studies with him. And then I was out in California for a short amount of time teaching. And then I'm back again now with Dr. Hanley at FTF Behavioral Consulting, doing more clinical work. And I think, I'm probably both a researcher and a clinician, but a little closer to the clinician side. That's where my heart is. I really love interacting with actual families and consumers we're trying to serve. So that's a little bit about me professionally. Personally, as we were scheduled to do this a few months ago, But, babies happen. So now I have 2 little ones. And so
congratulations.
Life is very busy. Thank you. Very blessed. I especially feel super blessed at like 2 a.m. But yeah, life is good. And it also has given me a lot of a new perspective on a lot of the work that we do, because, my kiddos are also going through learning a little bit to communicate and to wait and to do some of the things that I try to teach, the participants in the study that we're about to discuss.
Well, I do want to say, if you are out there and you're about to write your own dissertation, don't read this one first, because then you're going to feel like your dissertation's not as thorough as it needs to be. Because I'm very impressed that this was a dissertation, because it reads like so many of those old classic articles where they're like, we're putting like everything into this one study. We're looking at every angle. It's very thorough in that regard, in a way that I kind of like papers when they're just, here's a basic thing we did and it's easy, because that's me. But it's very rich. And so again, it's a good one to read as an example, but you might be discouraged and think yours isn't going to be as good if you're a new student ever. I'm just warning you out there. So just be careful. Be careful.
I'm not known to be concise, which is why the title of this article is incredibly funny and ironic coming out of our lab. Like, I have the shortest article title, I think, out of all of our cohort. And that is not my strong suit. So I do love that.
I like titles that give away the end. This is one of those kind.
Yeah.
It's like when you watch the trailer for a movie and it tells you the plot of the whole movie.
Exactly.
It's one of those kind of titles. Contingencies promote delay tolerance. Now we know.
Period.
Right? We should probably say what article we're discussing.
Oh, I guess we could.
We've been singing its praises, but we should say the title. Well, you said the title, but we'll say it again for everyone out there, and then we'll talk about it. So the article that we'll be discussing is Contingencies Promote Delay Tolerance by Ghaemmaghami, Hanley, and Jessel from the Journal of Applied Behavior Analysis 2016. And we also, this is a bit of an audible. So Mahshid, you're going to have to do most of the talking on this one, because it's a surprise article for us, but it's one that we're very happy to have to discuss and to add to this conversation. So hopefully the mic will pick me up, because I lean over to Diana's computer. It's Toward Trauma-Informed Applications of Behavior Analysis by Rajaraman, Austin, Gover, Camilleri, Donnelly, and Hanley. And that's in Java, but it's early release. So it just came out, I think, Mahshid, you said today or tonight?
Today.
So, okay.
At the time of recording. 2021.
Yes, 2021 is the time of recording.
Did you say that part?
In Java, yes. I sometimes threaten that we're going to do a vaudeville act, like an old style act, where it's like, give us some articles and we'll read them, or we got 30 minutes to like put together a coherent discussion of the articles as an episode. But we won't do that tonight. We'll just count on you. So what we'll mostly be talking about today are practical functional analysis, also known as assessment. Sorry, I call it the wrong thing. Used to be the ISCA. It's got a lot of names now. And I know Diana was telling me all the new names right before we came downstairs. And I was being very crotchety and saying, there's too many new names. I don't want to learn all these new names. So please forgive me if I use the wrong one. I will accept feedback, but I'm sure I will call it the old name or the made up name.
Again, that's not, maybe that's our fault a little bit. We're not concise with our naming, but the ISCA is still part of the practical functional assessment. But really what we're going to be talking about is assessment and treatment of problem behavior. And so, trying to kind of make that a little bit more accessible to be done in any context. And so that's where the practical part comes in. And think, going from the paper, Contingencies Promote Delay Tolerance, which now I would name it Contingencies Promote Tolerance and drop the word delay. We'll get back to that. We've just kind of maybe have become better at actually explaining what was done in the article. And that's where some of the names have come from, just to make it a little bit more descriptive for people to be able to replicate and to do in their settings. Because I know when I was, not in the research field yet, I would read articles and I would try and emulate what was happening. It just seemed like, even though there's a lot of detail provided, there was still a lot missing. I didn't have the whole picture. And so in our practice, we've tried to become a little bit better at giving really the real details and all of the important features, clearly describing those.
Doesn't it always feel that when you try to replicate a research article, like in the clinical field, like the most important piece You're like, but what do I do right
Right.
here? And you're like, it's not in the article.
And then you get one sentence and like prompting and reinforcement was used.
You're like, what?
You're like, but wait.
Or it's like how the old articles
Surely
were like
there's more.
Yeah.
described what like the analog functional analysis is, and they're going to spend 2 pages talking
right,
about.
yeah.
And now it's just like, we did an FA, but whatever. Go find the citation. You know what that means. Now it's just like they kind of keep cutting and cutting to the bare, not the bare minimum, but just what's
Right.
relevant.
But I think given that, I don't want to say these are new technologies, but these are, new applications of what we know, it's important that these articles that are going to review PFA and SBT take the time to walk us through in technological detail what's really going on so that someone who isn't, at FTF can then hopefully replicate those procedures.
So, Mahshid, I know the focus is going to be on looking at the contingencies, looking at the tolerance component of the training. But what I think might be helpful for listeners, especially if they're not as familiar with, even using synthesized FAs, using, different functional communication. Well, they probably know FCT to some extent, but certainly as it's in the PFA. Would you mind just sort of doing a general walkthrough from the beginning to end, sort of what does the procedure entail? And then we can drill down into the contingencies and the tolerance piece, like from the article.
Sure. And actually, if I'll kind of walk through the different functional assessments that were done in the article as well. So the practical functional assessment, and that's sort of talking about the whole process from the time you meet your client to the time that the assessment is done, really is looking at not descriptive assessment versus an analysis, but looking at this being a process that involves all of these steps. So you probably don't want to not have any information and just have an FA, toolbox and come in and just do a standard set of contingencies and test those. At least that's our approach. We say, the first thing that should happen is we should do an interview with people that really know the individual well. And so we start with that. And because we know that, indirect descriptive assessments are not necessarily reliable. They may not identify the variables that are really important, but they'll give us a lot of information. We're a fan of doing an open-ended interview where we really gather a lot of qualitatively rich information. So as opposed to asking informants to tell us, is it tangible? Is it escape? So having them sort of click little boxes, and where it might misinform us in a way, because we might assume that in fact is the function. The purpose of the interview really is to get a good introduction to everything that is important for that individual, both, everything they like and don't like, and what are some behaviors of concern. And so that's what the article starts with. So the functional assessment included an interview with caregivers, and that you have to also appreciate that I had no idea who these clients were, right? They were coming into a university setting, so I didn't have a history with the clients. It was very important for me to sit down with their parents or teachers. And I think for most of them, we had parents. And then for Will, who was an older individual in sort of a group setting, it was the staff. I was talking to them and finding out about all the things that make this individual happy. So what are some potential reinforcers, right? That's what we're trying to highlight. And not really looking at teasing apart these reinforcers. And this is where maybe the approach is a little bit different, but just kind of thinking about, if there was a context in which this person would not engage in problem behavior, what would that look like? And then letting the informants kind of give us all the qualitatively rich details that would be important for that. Then talk about all of the topographies of problem behavior that were important. And again, that's a synthesis as well. We're not doing an analysis necessarily on SIB or on aggression. But if there's a response class that includes both SIB and aggression and whining and crying, we kind of put it all together. So there was a synthesis of that. So synthesizing the evocative context, what are some triggers? Synthesizing the contingencies, every aspect of it, topography of behavior, as well as the reinforcers that were delivered. Now, if you look at, the first part, it wasn't necessary to synthesize once we had that interview for Will, for example. It was really more of an isolated function because it seemed like, we talked to the staff a lot and he was mostly motivated by food. There wasn't much attention being delivered, although, you could argue that when you deliver the food, there's some attention with that, but there wasn't high quality attention being delivered. There wasn't really any demands placed on him. So for him, the analysis was more closely resembling sort of an isolated contingency. Whereas for some of our other learners, like Alex, it seemed like everything, so it was escape to attention and tangibles. And really, his contingency can be described as he was like a little boss. He wanted to tell you what to do, how to do it, even if it was dinosaurs. A demand situation for him would be me telling him how to play with the dinosaurs. And as long as he was, figuring out what the dinosaurs were doing, he was happy. So we let the interview design our test. And that's what makes it a practical functional assessment, in that we start with an interview and then we immediately go to the analysis. For this article, we did do an observation. So we just kind of did, set up a situation where it wasn't necessarily the functional analysis yet, but we just wanted to see a brief preview of some of the scenarios that the informant described in the interview. We wanted to see, how hard is it to evoke these behaviors? And we also wanted some information on, the play skills, the language skills. We just wanted to have a little bit of exposure to the individual before we went to the functional analysis, because again, I didn't know these participants beforehand. And so it helped us define our operational definitions a little bit better and all of that. But now in our practice, we really don't do that observation. So we go from the interview to the analysis, because actually it's the people that know the individual best that are implementing the analysis. It's not me. So they already have, a lot of experience with the individual. And then once we were able to, in the ISCA, so then we did the interview informed synthesized contingency analysis, which again for Will wasn't synthesized, but for the other participants it was. So it was an analysis. It was a single test analysis. And we just wanted to make sure that we could in fact turn problem behavior on and off. And that is important, because going from the interview to treatment may be misleading. You may think that you have the evocative context, that you now have a treatment that worked, problem behavior is not happening. But had you run an analysis, you may not have evoked problem behavior at all. So you're not actually treating anything. You're not in the right context. So it is still analytical. It's just not hyper analytical in the sense that we're not teasing apart which variable. We're just saying, look, this is ecologically valid. This is what the client is experiencing all the time. So let's just test that. And then it's also very important for me to know that I have all the reinforcers necessary to turn problem behavior off. Because if I can't turn it off in an analysis, I'm going to have a hard time turning it off in treatment. And I'm probably going to rely on some punishers. And we really wanted to avoid that. So that was the start of it. And that's what makes up the practical functional assessment piece.
I'm sure not everyone would agree, but I think one of my favorite findings from, maybe not finding, I think it was sort of a theme that a lot of practitioners knew, but from a lot of the ISCA research and the PFA research, was that idea of like the extra function of bossiness. I know it's not its own function, but it's very well described here. And it's one of those kind of feelings, if you work with enough students, you're like, I don't think it's attention exactly. It's not exactly tangible either. They just want everything to be their way. Like, what do we call that? And, it's a combination of them. But I think a lot of the literature coming out of, Greg's lab really has sort of codified like that. Yep, that's a thing. We can test for that in a way that maybe we didn't, we couldn't with sort of just our 4 contingencies.
I personally never wanted to have that debate about whether we should call control a function, right? And we don't have to.
Well, and there are other, we weren't the first to sort of capture that. There's, the demand analysis previously, I think it's been labeled that, but usually I think what happens is, maybe the best way to describe it is that perhaps the more standard or traditional approach is to do the generic single test analysis, which when we look at consecutive case series, probably will not give you differentiated results more than 50% of the time, right? So then, okay, we need to make some adjustments, and then the adjustments are made. And I guess what was perhaps controversial, or maybe it still is for some researchers and practitioners, although practitioners sort of get it a little bit more, is that we're saying, well, why do we need to start there? Why can't we just have it be ecologically valid from the start? And I guess, many of us believe that really in the typical environment, we don't have isolated functions. In many classrooms and homes, multiple things are happening at the same time. And also the value of reinforcement really depends on what else is or is not available. So, my laundry may be an aversive task. If there's a really awesome show on, it may not be so aversive if I have to write a paper. So, it's really reinforcement occurs in a context, and we're trying to capture that context and create that context in the test condition.
You could do both of those things at the same time.
Write a paper and do laundry and watch TV.
Watch a show.
That's a lot.
Yeah, you're like, one sentence. Underwear. Wow. One sentence.
There's nothing I hate more than saying this task that could take me 3 hours will take me 12 hours because I am writing one sentence every 5 minutes.
Maybe that's why I get nothing done.
Maybe.
I figured out my life in this moment.
There you go.
Multitasking.
You're just trying
hard.
to consume all of your reinforcers at the same time.
Right? And I'm eating ice cream and drinking tea.
It's like a freakonomics. It's temptation bundling, I think they call it on that show. So, Mahshid, after that, you've got your treatment. Usually, for folks who've read, previous research using, ISCA, you're going to do some sort of functional communication training. And that's where your article comes in, because the challenge was not in I wonder if we can now teach these participants to use my way, or for like Will ask for food, use a phrase like some of the kids were using, can I have my way, please? The longer extended mans. That's not the hard part. The hard part is, that's great for, let's sit here and do the session. Like, we did it, everybody. We got, 10 trials, maybe 15 trials or 15 demands. We build up a little bit of a tolerance for waiting. It's what goes on for the rest of time for these participants, when they go back home. Because as anyone who's read FCT literature knows, it's sort of like, a fairy tale, and they live happily ever after. Wait a minute, it's not that easy, right? There's going to be more. It's not so simple. And then we get all of the kind of other downsides of FCT as a treatment, which is the extension, the generalization of the skills to the rest of life. So, or the lack thereof, I should say. Thank you.
It's not uncommon to have parents be really excited that you start to see new functional communication responses, and everyone's like happy about that for a little while, and then the question comes, well, I've been reinforcing this every time, but I can't keep doing that forever. When is that going to change?
Mm-hmm. And we're like, never.
Well, hopefully not never, because that's not real life.
But Mahshid, you explained it really well in the paper in terms of, what are the sort of next steps that are going to go into the functional communication training that, earlier research kind of, they stopped. They did the happily ever after, which made sense. It was a new technology at the time, but we recognize that these treatments have to live. They have to go with the individual and be a part of an intervention throughout all environments and with all caregivers. So, what were the challenges that you knew were going to happen or expected to happen? And then that gets, I think, very nicely into the actual, procedures you did.
Sure. So I think looking at whether it's ISCA, the assessment, and part of the paper too, the reason maybe we wanted to include 4 participants that were quite different from each other and gave us, also very different contexts that we were assessing was that we didn't want this paper. We had other papers that were debating, the way you should assess. But this paper in particular, the focus, as you said, was not about assessment. It sort of didn't matter what method of functional analysis you used. The important part was you identified a context, you identified a reinforcer that is maintaining problem behavior. Now, whether it was, isolated or not, it didn't matter. And so if you demonstrated that, removal of that reinforcer evokes problem behavior, delivery of it turns problem behavior off, we know that we have, in this particular instance, socially maintained problem behavior. And when you have socially maintained problem behavior, we start looking at that problem behavior going, our first sort of assumption as behavior analysts is, well, it's a form of communication. The problem behavior is simply communicating a need. I want this, or I want attention, I want tangibles, and I don't want this. That would be sort of escaping from this. So I would say that there's really no other defensible treatment as a first step, because we're saying, this is your voice. You're communicating to me that you have a need, and it just makes no sense to me that you would do anything but FCT. Because the first step is this person is not communicating their need in a socially acceptable way. It's actually quite adaptive for them, so we can't call it non-adaptive, but it's just not socially acceptable. It's not safe for that individual or others. So that's kind of the first step. Okay, we got to teach a communication response. Mm-hmm. And I think,
but Mahshid, I'm grumpy and I don't want to give my kid what they're asking for because I'm mad about it. I want them to do what I tell them to do.
And that's a legitimate concern too, because communication is the first step. And in fact, if you look at FCT and sort of, what entails FCT, Tiger and colleagues in 2008, when they described, FCT as a treatment, they didn't say, yes, identify. I mean, that was the first step, identify, an appropriate, easy response to replace problem behavior with. But that's not where it ends. I know that's where a lot of articles maybe have ended, but that's not where it ends. He does talk about, and then you have to extend it to the relevant environment. And so when we think about, okay, what's the relevant environment? It is dad, coming home from work and not wanting to basically comply with everything that his son is asking him. And that's just not realistic. And so maybe, what's missing and what we need to focus on is that communication is one piece of the skill deficit, but not the entire piece of the skill deficit. So the approach for the longest time was to say, okay, we're going to teach the individual to communicate. And once they've learned to communicate, we're going to teach them to wait. That's the next skill. How are we going to teach them to wait? The first thing that kind of came to mind perhaps was like, we're just going to tell them to wait. And then they wait. And the waiting was sort of, perhaps assumed to be lack of behaving, right? I tell you to wait and you just sit there and do nothing. And one of the things I wanted to sort of, I guess, get rid of, and why I want to get rid of the word delay now in that whole procedure, is that there is no such thing as lack of behaving. The individual is going to continue to behave. Some of those behaviors we label appropriate waiting, and some of those behaviors we label as, not waiting, not tolerating, engaging in problem behavior. And most of the clients that we're going to be working with, most of our students who have the skill deficit, who have severe problem behavior to the point where they're coming to see you, have an extensive skill deficit where by you denying the reinforcer and simply saying, now you got to wait, you're not going to have an extinction-induced variability in responding that results in good responses being emitted, right? You're probably going to have emergence of new topographies of problematic behavior. So what this paper was talking about really was, it's not enough for us to simply expose the individual to gradually longer and longer duration of time, right? The progressive delay and exposure to that time between they requested and delivery of reinforcer is not enough. It doesn't matter how slowly you increase that. You're not going to, at about 16-second mark, not just in my paper, but in a lot of other FCT papers, you see an emergence of problem behavior, right? 16 seconds gives you nothing from a practical perspective of, everyday life. And then the other, data that the other sort of variable we wanted to rule out was, well, do we just need to have some other things available for the child to do, right? There's some literature suggesting that, there's just got to be some toys in the environment, some other activities. And so, your iPad's not available, but hey, there's other things you can engage with. And so we wanted to create two conditions where in one condition, we were exposing you gradually to longer wait times. There were other things available. And in case of Alex, where there was escape as a function as well, we also included prompting. So there was 3-step prompting him to do the task. But what we wanted to know was, is it that, or is there a need for an actual response contingency for the return of the reinforcers? So it's not just a passage of time. It's you have to engage in a response post-communication that then is reinforced by return of the reinforcers you requested. So really, it's about response chaining more than anything. And so in a nutshell, that's what we found. We found that we needed to teach these responses. Now, in this paper, for some of our participants, we used a DRO contingency. And to be honest, that's a mistake. I think since then, I don't really use a DRO contingency anymore because, again, a DRO contingency means as long as you don't engage in problem behavior, I am going to return these reinforcers after, let's say, 10 seconds. But that doesn't mean that good behavior is happening in those 10 seconds. Maybe your target problem behavior is not happening, but compliance per se is not happening. Academic tasks are not being completed. Social conversation is not happening. Good play is not happening because you don't have a contingency placed on that. You're kind of leaving it up to chance. What is the learner going to do? And hoping for the best. And given the time that you're spending, I think it would be better as behavior analysts for us to use every second and actually teach a skill. So use DRA contingency. And when we see that, for example, with Alex, we actually then had a contingency where it wasn't enough that we were prompting him through the task. He actually had to do some of these tasks independently. So if it was, he had to do 5 academic demands, maybe we would present 15 academic demands before he was cooperating with 5 of those, and therefore a reinforcer would be returned. So a DRA contingency was placed. So again, communicate, and then tolerate, and then cooperate. Those are the 3 sort of categories of responses we're looking for.
It made me so happy to hear you say that because I hate DROs more than anything
in behavior
analytical literature. And every time I read them, I get so grumpy because you like you said, you're not teaching anything, and it makes me like I feel like it's like a little bit of a Band-Aid. So I'm glad that you say that you wouldn't use that again because I hope no one will use DROs again in life.
Yeah. I mean, you might combine it. So for example, now I think we're like a DRA. So don't engage in problem behavior and do these things. So we're going to specifically
I'm okay with that.
I'm okay with that. A contingency for problem behavior not to occur. But, I'm going to show you what to do, which I think will really sort of increase, we need data on this, but I think as a parent, I'd want to see some actual skills being developed here, right? So like you said, the father saying, I don't want to give in. I don't want to, deliver whatever he's asking for all the time. It's a very valid concern and complaint and legitimate, need for parents too, to say, I just can't. Even if I wanted to, I really can't. And so we used to say, no one's going to thank you for doing FCT because sure, problem behavior is not happening, but repeated and excessive manding is inevitably going to lead back to problem behavior.
Mm-hmm. Mm. Hey, everybody. Just real quick, wanted to pause from our interview with Dr. Ghaemmaghami to make sure that all of our listeners know that ABA Inside Track is ACE approved. By listening to the show, you're able to earn 1 learning credit. All you need to do is finish listening to the episode, then go to abainsidetrack.com/getceus, GET-CEUS. You need to enter in some information, though, including 2 secret code words that we've hidden in the episode. These are secret guest code words from Dr. Ghaemmaghami. And the first one is skills, SKILLS. Much of what we're talking about tonight is actually the training of new skills. Much of the work many of us practitioners, researchers, and teachers are doing require us to learn skills and teach skills because, as they say, you need the skills to pay the bills. Skills.
Do you want to be a BCBA?
Sure, we all do.
Now you can come to Regis College in Weston, Mass. to get your graduate degree.
Choose from any one of these courses.
Masters of Science in Applied Behavior Analysis.
Masters of Science in Special Education.
Dual degree in Special Ed and ABA.
Or be eligible for your postmaster's certificate.
You can complete your degree and be ready to sit for the exam in 2 years. And our 2017 grads had a 100% pass rate on the BACB exam.
Come enjoy practicum placement support, ethics mini handbooks, PhD-level professors, small class sizes, and a service trip to Iceland.
If interested, don't delay. Supplies are limited. Learn more at regiscollege.edu.
Again, that's www.regiscollege.edu, regiscollege.edu. One more time, www.regiscollege.edu.
See you there!
And now back to our interview with Dr. Ghaemmaghami. You kind of mentioned like the excessive manding. You know, you mentioned it was in the study, I should say, a lot of extra measures in terms of like the collateral responding that comes with FCT. That wasn't true for all of the participants, but I thought that is great to include that because, there is always that question of like, well, if they ask for it, they're just going to keep asking for it. And you had at least, I think it was one participant that the issue was not, excessive problem behavior so much as the excessive, not exactly whining, but the constant FCT requests. Had you always intended, like you knew there was going to be some level of collateral responding after you did the interviews? Was that something that you added sort of later into the study as something that you wanted to continue measuring?
I think that probably came from being, a clinician and a therapist in my previous life and kind of knowing that, okay, sure, the target behavior is not happening, but you don't have the full picture unless you really look at not just the positive effects or the direct effects on your target behavior, but on everything else that's happening. And that includes both, negative side effects of your treatment as well as positive side effects of treatment. So what we tried to sort of measure was both. And, we kind of let the context dictate what those collateral responses were going to be. So you're right. For some of our participants, it was repeated manding. For others, it was emotional responding, like crying. Because, and for little Jack, who was like not even 2, crying excessively can be quite aversive to his mom, who I think without us being in the room and supporting her through that would probably reinforce the crying. And in fact, these days, I would say that let's not put crying on extinction at all, because a lot of times with especially a young child, once they enter that emotional land, they can't get out of it. You need to help them actually calm down. And this kind of brings us to the trauma-informed care as well, which is, the paper that I want to connect to this, because having a complete picture of what are the effects of our procedures is important. We have a lot of efficacy data. We have a lot of data on the effects of FCT on the target behavior. So if, aggression was the goal, we have that. What we don't have is, okay, if aggression is eliminated, but you're also not reinforcing every man immediately, what else is happening, right? So even if the individual is communicating with a card and you remove the card because it's not available right now, are they really just okay now and not engaging in any other way of manding? I have a hard time imagining that. And so I think the next generation of FCT literature, and really as a field, we kind of need to move towards effectiveness. And we did a paper on FCT efficacy, from efficacy to effectiveness, and we talk about that. We talk about if we want to say that a treatment is ready for large-scale dissemination, that this is something, evidence-based practice, individuals in all environments should use, teachers, parents should use this treatment, we need to look at the full picture. And the full picture is all the other collateral effects on global functioning, side effects of treatment. And so, yes, repeated manding, nagging, if you want to call it that, will also be disruptive in a classroom, will also then contact, reinforcement, and it will sort of reduce the extent to which teachers and parents will use that procedure because, they don't want to tolerate that, for example. Crying will be important. And other new topographies of problem behavior that maybe were not in your definition will also be very important. In particular, let's say you put aggression on extinction and now you've got SIB happening. And that wasn't in your original, target behavior. Well, that's very important. And we probably need to make a note of that. And so when we think about what is, how do we do trauma-informed care? We really want to kind of, as much as possible, move away from extinction and punishment, because extinction and punishment really puts the individual in a situation where they can't, the needs are there, but they don't really have the skill set to deal with either, a delay to that need being met or to cooperate with the expectations of whatever context they're in, whether that's academic expectations, social expectations, or whatnot. And so I really think as a field, we need to focus more and more and more on identifying the entire skill set that's missing and combine it. So no longer treating problem behavior in this sort of isolated way and then having skill acquisition programs on this other island, but combining the two things together and saying, as part of reduction of problem behavior, what we really need to do is build skills, and it can all be done in one. And so that's sort of what contingency-based delay was about. It was about explicitly teaching the skills necessary to be able to tolerate that time between communication and delivery of reinforcement.
I really like that point because as a professor and working with new, graduate students in the field, I noticed that while they're working, in class and we're talking about different problem behaviors or, skill-based, they'll only talk about one or the other. I'll give an example and it'll only be problem behavior or it'll only be a skill-based, and they haven't yet incorporated the two. And I'm like, those go hand in hand. And they're like, yeah, but I only deal with problem behavior. I'm like, no, well then you're doing your job wrong, right?
Yeah.
Because
I put the kid in a sack and they have no more problem behavior. I'm really great at it.
And so I think that's really important
Not
for
how
us.
it works.
Yeah, not at all how that works.
I can't see it. Maybe it's not happening.
You guys are bringing up a really good point, actually, about, the reduction in problem behavior is not sufficient. So, we use a behavioral health index assessment right now in our practice as well that kind of looks at, okay, not just how much problem behavior is happening or not happening, but all the other sort of aspects of the individual's life, right? So, mechanical and chemical restraints may be why problem behavior is not happening. Exclusion from a lot of community and educational settings is maybe why problem behavior is not happening. So if we really look at the quality of life and then see, okay, to what extent is this individual actually accessing all of these other opportunities that they could access, and problem behavior is not happening, they're able to tolerate and cooperate with these contexts, is what we really want to get to. And so, yeah, in the interview part more recently, so when I do the open-ended interview now, everyone wants to talk about problem behavior, what the problem behavior looks like, especially the severe form of problem behavior. And I actually find that is probably the easiest thing. I probably spent about 20 seconds saying, okay, so what are the severe problem behaviors? Aggression, destruction, yes, and it's very, very dangerous. Great. And the majority of the time, I spend trying to identify other minor forms of problem behavior, maybe just some of those precursors, mild indications of the individual being upset, the context that I'm presenting to the individual being challenging and difficult. Because when we think about trauma, and what Rajaram and colleague talk about, is the first thing is we don't want to add to the trauma. And actually engaging in severe problem behavior is traumatic, not just for everybody else, but for the individual who's engaging in that behavior. So can we identify some precursors and potentially intervene at that point so we don't have to either experience a traumatic event again through really severe problem behavior or risk safety? And then I spend a great deal of time talking about, okay, if problem behavior was not happening, if you presented this context and the individual did not engage in problem behavior, what should they be doing instead? What's a fair expectation, right? So, for example, you have a 6-year-old and he's in math class, and sometimes I get things like, well, he should participate in a 75-minute block of math. I'm like, do you do 75 minutes of work? I have a hard time with 20 minutes. So, really getting to what is the expectation? If problem behavior wasn't happening, what is the response chain that the child would engage in? And it's that response chain from, okay, well, let's say you interrupted somebody, you're on your computer and I come over, I'm like, hey, can I have your computer? I mean, the first thing you might say is, 1 second, I got to finish something, right? So you communicate, maybe you ask for more time, and then potentially, you're ready to give it up. And then you have to give up your activity, transition to another activity. Then, what's a reasonable amount of time that I've taken your computer away from you? And then what are you left to do? So identifying that response chain that the individual should engage in, that's fair, that's reasonable, that's appropriate for their current skill set, that provides them with a reasonable amount of support. For example, let's say, they have to do academic work. Well, do they do one-on-one work? Do they do independent work? So I try to get really to, when would you say that you don't have challenging problem behavior that's interfering with this individual learning and operating and cooperating and surviving and being a participant in their typical social circle? And it's identifying that response chain and then specifically teaching every single one of those responses, not just communication. that's important. And I think, I actually really love this paper. I want to refer to it because when they talk about, okay, how do you do trauma-informed ABA? One of the things they talk about is this focus on building skills. So, if we look at on page 5, I believe they start talking about, a possible framework for incorporating trauma-informed care into ABA. They talk about, one, acknowledging trauma and its potential impact. I know this is a little bit of an uncomfortable area for behavior analysts, it gets a little bit soft maybe. And ensuring safety and trust, right? So again, coming back to, can we, identify all topographies of problem behavior and not just intervene on the most severe form? And by acknowledging sort of even an individual's affect of changing and, they're becoming upset, responding to that, acknowledging that will build more trust between the student and their caregivers. And then promoting lots of choice and giving some control, right? You're taking away a lot of control in the process of teaching these skills, but you can reintroduce some healthy level of control and then really emphasizing the skill building. So I think that's what we want to focus on. And we didn't know it yet. We didn't have the right language for it yet, but that was kind of the paper in 2016 was sort of the beginning steps of me trying to understand what exactly it was that was missing from our previous attempts to treat problem behavior and where we need to go.
Mm.
So when you talk about skill-based treatment, that's moving through all of those, kind of like that TA that you just described, right? Of all of those skills that surround the functional communication response.
Exactly. In the 2016 paper, we didn't really get into, we talked about, okay, and then we introduced demands. We introduced some academic demands for Alex, and we increased the number of demands that he needed to comply with, and we increased the complexity of those demands. But we didn't really provide a lot of detail, like useful, technological description of like, how exactly did I do that? And there was a lot of sort of clinical judgment. And I had a background in EIBI that was very helpful because, I had some idea of like breaking down the tasks and introducing things in a way that was meeting him where he was at and then kind of increasing the difficulty of those tasks. But again, I think recognizing that sometimes even in a clinic, in an ABA clinic, for example, the team that's treating problem behavior and the team that's sort of skilled at skill acquisition are two different teams, and they don't necessarily speak to each other. And we're trying to encourage those two teams to come together and for this to be one program. So in a more recent sort of description of this process, we've really broken it down. And through sort of our own behavior being shaped by some of the applications of what we did, learning that not every participant we worked with could even tolerate the removal of the reinforcers immediately. All right. Sometimes simply removal of reinforcement results in such a reaction. And now we are in a traumatic, emotional sort of state that it's hard to prompt, it's hard to maintain safety, it's hard to really get any good responding. So we've really slowed things down in our implementation of this. And now we really progress that EO presentation much, much slower. So we might come over and just indicate that I'm about to end what you're doing, right? And so we're like, an individual first needs to sort of tolerate this signal, right, of like a worsening about to happen. And without me kind of coming into your space and removing your items, like there are some old videos of me, going in, like just removing the iPad. And I hate those videos. And I really want sort of to redo all of that. And I think about it now as a parent, if let's say I saw my child in her preschool classroom and someone, either, one of her buddies or the teacher just came over, no warnings, no nothing, and just took her iPad away. Right? What would be an appropriate reaction from her? Would it be really appropriate for her to just be like, oh, okay? Or would it be appropriate for her to kind of lash out, right? So there's some self-advocacy here too that we want to be mindful of. And so we don't do that anymore. We've kind of evolved past that a little bit.
Mahshid, please tell me that now there are videos, not of you grabbing things, but of you like slowly going over, kind of like Dracula, like I'm about to take your eye, I'm signaling it from far away.
I mean, I wish I was doing more sort of, I'm not as much of the implementer anymore, but we kind of say, you know what, let's just do like a little clap. Because a lot of teachers actually, when they're about to instruct, kind of like put their hands together. Now, we've exaggerated this a little bit, right? But because we want to make it very clear at the beginning of treatment, again, we want to sort of, before you invade a child's space, who, again, we're saying, look, we're going to go on the assumption that a lot of the students we work with have experienced trauma. And that trauma has included people having their hands on them, doing full physical prompting, escape extinction. And so there's this history that we have to recognize. So the first thing we do, and then we're not getting into their space, we're just like, okay, we're all done with that. And that is enough for sort of the kiddo to look up and say, my way. We're like, okay, right? Like nothing's been removed. And we just kind of want to have that be a very business-like relationship with no emotions attached to it. And then once that's happening, and depending on the learner and really, their social circle and their communication partners and the extent to which they want maybe a more appropriate communication response, the extent to which a more complex communication response is necessary, right? So if a student doesn't have one-on-one, maybe they do need to gain attention because someone's not right beside them. So we do need to add some features to that communication response. We do that. So maybe they have to say, excuse me, more time. And then really, you're not going to go along with any other expectations until you've stopped doing what it is that you are doing, right? So the first step really needs to be relinquishing your reinforcers, relinquishing your activity. And so we focus on that. We're like, before we present any other demands, we need to get some cooperation from this individual to actually stop doing what they were doing. And so we focus on that, relinquish your stuff. Now transition with me to the next environment. Now, whether that's a physical transition or just moving from, looking at your computer to over here looking at the books, right? Again, can be individualized. And all of these things were done in this paper, but they weren't really described and they weren't as systematic as we would like it to be now. And so, okay, you communicated, you tolerated me saying no. Sometimes you're like, okay. And that okay response kind of came because a lot of times kids, as soon as they heard no, they would go, no, right?
Yeah, right.
They wanted something incompatible with that. And then once you come over to the space where now, the adult is really in charge, we kind of want to communicate that. Now we're building those skills. And again, we're building it slow. You're not going to introduce the hardest task. If a learner is finding error correction or any kind of physical prompting difficult, you're going to leave that for much later, right? Maybe you're going to work on some mastered skills. Again, you're just building this behavioral chain. And at every step of this process, you are rebuilding trust, right? You're saying, just come with me. It's not going to be that hard. We're only going to raise the bar ever so slightly. So from a learner's perspective, it's not a big change, right? And then you've got this awesome reinforcement context. And the synthesized reinforcement is really important here because if you're trying to build not just communication, not just a simple communication, but this complex repertoire of communication, toleration, relinquishing, cooperating, for a good practical extent of time, you're not going to do that for half a smarty, right? We really need to think about the motivational distance here. So we want to have a really highly reinforcing context. It's like Disneyland on steroids so that I can get this momentum and you go back. And when the learner goes back to their sort of what we have named happy, relax, and engage, and I'll come back to that, they are more than happy next time you interrupt because there's, again, very little expectation. And every time we raise this bar, we make sure that it's ever so slight so that it's easy for the learner to be successful. And it's not every trial that they have to kind of do the whole thing, right? Sometimes all you got to do is communicate. Sometimes all you got to do is cooperate a little bit. Sometimes all you got to do is I say, hey, can I have the iPad? Thanks so much, buddy. I just wanted to see something. You can have it back, right? So there's this variable ratio embedded within that keeps the responding, keeps cooperation high. And then they go back to reinforcement. And I think more and more as a team, we're becoming sensitive again to not just that we designed a reinforcement context, but that the individual is actually consuming their reinforcers. Because if you may think the child is in reinforcement, but they're not, because they're mad and they're not actually playing with the iPad. And if you just use like time sort of as a criteria for going back to an EO context, the learner may not have had any reinforcement at all. Right. And that became clear to me when I was doing this paper, as well as some other applications of this process, when, with some learners who, for example, needed to set up the dinosaur set and restart their play and maybe find a YouTube video that they wanted to. It takes a bit of time to find and reset the reinforcement context before they're kind of relaxed and actually enjoying it. So now we're saying, forget about time. It's not 30 seconds. It's not 1 minute. It's not 2 minutes. It's potentially 2 minutes of HRE, 2 minutes of happy, relaxed, engaged. But maybe it took 7 minutes to get there. So, a lot has changed and evolved since this paper, but this was sort of the starting point for some of these thoughts. And we learned a lot from that. Mostly that we need to actually explicitly teach the skills we want to see, and that it's not just communication.
Mahshid, I really do like the way you described the skill development. I think it's must be a fascinating way, and I don't know if you use this when talking to either other professionals who aren't behavior analysts or to families, kind of reconceptualizing what is weight. It's not a behavioral vacuum. It's a series of behaviors different than the access to reinforcement, the behaviors that access reinforcement, or I should say the behaviors that allow them to contact reinforcement to some extent. And I know kind of one of the questions, and you covered it, I didn't even really need to ask it, was kind of looking at social validity of these procedures, because I think I've certainly heard this from a lot of other individuals. I know with my own children, sometimes I feel this way. I want you to wait. And when I say wait, what I actually mean is I'm like trying to do something. I need you to sort of like vanish for like a minute, and then I can handle whatever you're doing, because I just have to get something done and I need everything to go. I need my environment to be cleared.
Yeah.
And the idea of sort of FCT and teaching another skill, I could see that being challenging. Okay, so now you're asking me to teach them to ask for the thing that I don't really want to give them. And now you're telling me that I have to engage them somehow in the time between when they ask for it and then when I deliver it to them, when I kind of just want it to all vanish for a second, But the way you described it, I'm gonna steal some of that, which I hope that's okay, in terms of we're talking about developing the skills. Because especially with, say, like a teacher or a professional a parent, being a teacher, it does would allow them to see, I'm always teaching these skills, which again, that's certainly doing anything is more challenging than absolutely nothing around you. But I think that sounds more enticing to me. I just hear that, I say, I want to be a part of this skill development. I want to teach these skills, as opposed to wait versus do a bunch of, actions, which I think inherently becomes like, no, it's too much. Now I'm overwhelmed. You're overwhelming me with that.
And, so when we published in 2016, I think I listed one of the limitations as, this is still not practical, because, if you have to prompt through all these responses and, like you said, deliver attention in this way, why don't you just play with your kiddo when he asked? And so, we again have become better at, okay, so what are we doing here? One of the scenarios that might come up is, again, a parent who simply needs some time to, answer an email or finish a phone call. And so in that situation, when we look at the response chain required, really is, again, maybe the child can still communicate. Hey, mom, can I, X, Y, or Z? And mom might say, not right now, in a minute. And again, we want sort of a toleration or acknowledgement of, okay, I heard you. So a child might say, okay. Now we need them to basically transition and relinquish sort of mom in a way. And so what the skills you're looking for there is, turn away from mom or dad who are busy right now, and perhaps scan the environment and independently find something else that's available. And those are some foundations of leisure skills, right? In the sense that you need to kind of look and see what's available, transition over there, take the stuff out, right? And this is like a common problem in many households where you have a room full of toys and the kids are sitting on the couch going, there's nothing to do, right? And so those are great skills for many, many kids. And many of us, the pandemic showed us that many of us need better leisure skills and the ability to find things to do when the things that we maybe are used to doing are not available. So that's what you would teach. And maybe initially in the first steps of treatment, you don't have the practicality you're looking for because you need to specifically teach those skills and you don't yet have, this long time kind of being free from your children. But eventually you kind of teach them to, go over there, choose a few activities, transition between activities independently. Like there's no specific thing you need to do right now, but here are some appropriate things. For a typically developing kids in that scenario, maybe you can use a DRO because they have enough of the basic skills of play, functional play, imaginative play, that they could kind of figure it out. If you just did a DRO, that would sort of induce some appropriate behavior that they could engage in because that repertoire of play and it already exists. But for a kiddo that is missing those skills, they don't yet have a strong play repertoire. You have to teach it specific. You have to actually teach those independent tasks, in a sort of maybe a one-on-one setting first before you could say, okay, now go over there and do some tasks on your own.
Mm-hmm.
So to take it back a little bit, I know you've been talking about that transition piece between being in, as the client, your perfect setting, right? And then transitioning over to a learning setting. And I totally understand why that occurs, right? Because we need to set up opportunities for contingency because contingencies promote learning. And we know that pretty well established. But I think one of my questions was, as we think about that transition, and you've talked a lot about how it can be done really slowly and carefully and incrementally. But if we're looking at it from this trauma-informed perspective, it is still that type of transition, right? And we're still looking at it, drawing a distinction between those two. So my question was, in the SBT context, when we're making those transitions for clients, can they, or do you regularly have them bring activities or special toys or transition objects with them? Or what's the approach with respect to stereotypy or other potential coping mechanisms?
Great. I think one of the ways we can potentially incorporate trauma-informed care into our practice is by simply not having necessarily these hard and fast procedural rules and having more of a value-based decision-making approach, right? So it's not so much that, there's a toy in your hand, I need to take it away at whatever cost because that's what my procedure says here. Yeah. You need to give your toys up. So if we have a learner who, for example, has a hard time, giving up anything. So it's not one specific toy, but, they just have a hard time relinquishing their stuff. Then I would say, let's not even think about transitions yet until they can relinquish some of their stuff. So you got to break that thing up, and sometimes maybe it's just simply looking up away, from their items a little bit before they can even let it go. Sometimes for a learner who has a history of, things disappearing because there's this history of trauma, we could think about, well, can they, instead of handing it to you, which may seem like you're taking it away, can they put it in a little box that's safe and it stays there, right? So it might make a lot of adjustments like that. But let's say you had a learner who has this one special toy that they're really attached to. Can we just leave that for later? Can this thing come with them and go everywhere? And we get some compliance with that, as opposed to going through some traumatic experience of giving this thing up because you don't yet have that trust, right? Maybe they need to experience, I comply and cooperate with some of your expectations. And wow, I go back to my fun place again. Then that item will actually be, they'll be less attached to the item even. And stereotypy, I would say, is again a same thing. It depends. Does the stereotypy actually interfere with the expectations, and is that interfering simply because we don't like it, or it's there's a lot to stereotypy. Is it who is it really harming? In what way is it really interfering with anything? Do we even need to reduce this stereotypic behavior? And if we do, then I would say, can we provide some access to it in the happy, relax, engage space where, you go back to it? So, if the stereotypy involves, for example, spinning around and you're trying to transition from one location to another, that's a good example of stereotypy that needs to stop because we do need to transition. But potentially some vocal stereotypy that you can engage in while you're transitioning, maybe we don't need to address that right now. So really picking your battles, thinking about, safety, televisability, more long-term goals, and just thinking about, okay, ultimately we can get there. We might have to go a little slower. and really thinking about the way in which you get there matters. It's not just the goals that matter, but how you get there and what procedures you're putting in place. And, it needs to also be socially valid. So looking
Absolutely.
at, socially valid goals without socially valid procedures is kind of meaningless. Because if they're in the next environment, will the teachers do that? Will the parents do that? All of those things matter. And it kind of comes down to the maintenance and generality of FCT.
So I think this is a good point to move into the last segment of our show, the dissemination station. I'll give you a cue there, sound effects guru. So Mahshid, for listeners, I should say first, dissemination station is a section of the show where we sort of wrap up and we, either ask a guest or we talk about the research in terms of what is the big take-home point. You phone a friend. The big take-home point of the episode. So a lot of times, Mahshid, for like our topic, like we've been discussing today, the teaching tolerance, formerly known as delay tolerance, we would say, what's best practice? But I feel like we just spent the last 25 plus minutes really going over some of the best practice components when it comes to the trauma-informed nature of using components of this protocol, of functional communication itself, having goals. So I don't know if we really need to do that. So I'm going to switch it. And instead, I would love to hear kind of pie in the sky. What's really next for these procedures? What are the questions that they have to be answered as soon as possible? Or what are some questions that down the road, you would love to get an answer to, whether it's in your own research or somebody else comes along and researches it as well? Like what's next, do you think?
Well, I think, just looking still at incorporation of this treatment all day in every environment, so where it's a way of life, really. So we're still, don't really have enough data on FCT and skill-based treatment, not just being implemented with success in sort of these contrived practice sessions, but looking at maintenance without continued involvement of, the experts, or in our case, for example, we certainly didn't have any maintenance data in the 2016 paper. I don't know what happened 6 months later, whether the parents were able to maintain those procedures or not, to what extent did it match everyday life. For me, when I look at every scenario in life, it kind of fits this whole model. Like there's always, you want something and sometimes you can have it, sometimes you can't have it. And when you can't have it, there are these skills you got to engage in. So it kind of fits every scenario, from feeding to sleep to everything. But the extent to which we can kind of have this happen all day and for the important components of the treatment to be maintained, we really just more than anything need some effectiveness data. And, in the paper in 2021, where we talk about FCT and we look at the data we have, evidence we have for it, we have a lot of evidence of efficacy and very little evidence of effectiveness. We have some limited evidence that's good, it's promising, but I think when we start to really look at generality and maintenance, we're going to see more and more. My guess is, might be biased, but my guess is that unless we have specific, again, skill building components that have been added to FCT, we're going to see that this process falls apart and there's a revolving door of those same students and learners coming back for treatment of severe problem behavior in a different form or shape. Anecdotally, in my clinical practice, we're seeing learners who perhaps, had some compliance training, there was good instructional control, they were little, and, there was this whole use of escape extinction and sort of follow through and prompting through tasks. And now, they're older, bigger, stronger, and they are not necessarily complying with many of those contexts anymore. So now we're trying to shift our focus on cooperation, really focusing on getting cooperation. And so we need some data, though, because in our newer sort of approach to this, we're not relying on extinction as much. And we are now, in the interest of safety, recommending that at any point, if safety is a concern, reinforce that behavior. That is a recommendation I'm making to practitioners. And anecdotally, especially during COVID, the last year, where I'm sort of on Zoom at coaching people to do this, it has resulted in progress. It has resulted in safety. It has resulted in less injuries. But we really need an experimental design and data and review of the data to make sure that, previously we really didn't have a good evidence for FCT without extinction. Mm-hmm. So, the extent to which this will ultimately be effective and strategy is a question that we need to answer. And it might be that because of the difference in reinforcement, maybe quality for the behaviors you want to see, and also the much more effective differential reinforcement and prompting and shaping that's used in SBT, that it's okay, that it will still be successful. But that is a question that is a bit of not a concern for me, but I think we got to do our due diligence and look at those data in a more systematic way. And then a lot of times people ask, what's better? What's the order of doing things? Should parents start from the start, or should an expert do it and then the parents do it? Should they do it simultaneously? We've come up with a series, like I described, you communicate, and maybe we build the communication, maybe then you transition. But maybe for some learners, it's a different order of things, right? And so those types of what should come first perhaps needs to be better defined, and it might be idiosyncratic. And of course, then, social validity data of people, not just both subjective social validity data and objective. So people, verbally saying, yes, they like this procedure and it looks good, but also maintaining it, which is ultimately the measure of social validity, right? So looking at those data is sort of what I would hope to do at some point.
Oh, well, it's a lot of steps. Thank you for taking time out of reaching them to talk to us tonight. If there are listeners out there who would like to learn more about the PFA, learn more about this research paper, ask you any specific questions, is there a place that they could contact you?
Yes. To learn about what we do and PFA and SBT, there's the free website of Practical Functional Assessment, which we try to sort of keep up to date with a lot of our most recent materials and a lot of resources. And I am currently at FTF Behavioral Consulting, so I can be found on that website, which is ftfbc.com. And my email is drg@ftfbc.com.
That's great. Well, Dr. Mahshid Ghaemmaghami, thank you very much for coming on the show and sharing your research and talking about it so eloquently with us tonight. Thank you.
Thank you. This was great.
Thanks once again to Dr. Mahshid Ghaemmaghami for coming on the show and talking to us all about the procedures formerly known as delay tolerance, as well as the practical functional assessment and the many new skill development techniques that she and her colleagues are researching and working on and practicing and bringing to families. And of course, you probably want that second secret code word, our guest code word, and it is televisability. TELEVISIBILITY. Televisability. What's televisability, you might ask? Well, in thinking about trauma-informed care and doing the best we can for our clients, it's really that concept of, is what you're doing something that you would be proud of? Is what you're doing something that you would want other individuals to see? Is it something that you want people to see regarding yourself, the client you're working with? Basically, are you doing something that you'd be happy to have on the 6 o'clock news, or since it's not the olden days, probably on YouTube or on all those sort of like clip shows that go over like the worst things that happen in the news on YouTube? Yeah, you don't. So always make sure you're doing your best practice. Anyway, that code word, televisability. We also want to make sure that we thank a lot of other people, including you, the listener. Thank you so much for listening to ABA Inside Track. We hope you enjoyed the show. If you did, please leave us a review on Apple Podcasts, Spotify, or Stitcher. Hey, we'd also love it if you subscribed to the show or maybe even reached out and talked to us on social media. We're on Facebook, Twitter, Pinterest, and Instagram as ABA Inside Track. You can also find these episodes on YouTube with the YouTube subtitling feature. You can go to our website, abainsidetrack.com, to get access to all of our previous episodes, to purchase CEs, and to find links to all of the articles that we discuss in our episodes. And if you want more ABA Inside Track Plus, get these episodes a week ahead of time, why not join us on Patreon, patreon.com/ABA Inside Track, where we've just updated many of our tiers to include some new tiers to allow for more voting on episodes, some live episode events, as well as our super long book club podcasts, which are for premium patrons at our $10 level, where you can get 2 full hours of a discussion of a book every season of the calendar year, worth 2 CEs for no additional cost. That's just a benefit joining on patreon.com/ABA Inside Track. You can also email us with ideas, feedback, or whatever you like at abainsidetrack@gmail.com. Thanks to Jackie. Thanks to Diana. Thanks for Dr. Ghaemmaghami for coming on the show. Thanks also to Dr. Jim Carr for recording our intro and outro music, to Kyle Sturry for our interstitial music, to Dan Thabit of the Podcast Doctors for his editing work, and Hollis Irvin from Sycamore Workshop for his visual design. We'll be back next week with another fun-filled, full-length episode, but until then, keep responding. Bye!